Hi folks, this is Dr. Burke with Pathways Integrative Health Center here in Golden Valley, Minnesota. In our office, we specialize in supporting people to help get their health back. People have been dealing with long-term chronic issues like weight issues, pain, headaches, brain fog, fatigue, digestive problems, just not feeling well. And what I most commonly find in a lot of these people is an underlying poorly diagnosed or poorly managed thyroid issue. These patients come in and say they've seen multiple different practitioners or just one practitioner who's not listening to them, and maybe they're saying they're fine, their lab work looks good, or they're on some sort of thyroid medication and they're always having to change it or switch to medication or change the dose, and they just feel like they're on this ongoing merry-go-round where things just aren't making progress. And there are some big reasons for that. I kind of hit on 4 of them in this short video here. One of them is this: most healthcare professionals are not up to date on current medical science. You know, they say back in the 50s that the body of medical knowledge would double about every 50 years. And then got to the 80s, it would double about every 7 years. They said around 2010, medical information doubled every 3 years. And they're estimating now in 2020 that the knowledge base of medicine is going to double every 3 months. That's just a flood of new information. There's no way a doctor can keep up with it. And then also often they may be well-meaning and well-intentioned, but they're in a model that does not embrace change. You know, most thyroid approaches in conventional care are based on ideas based on 50-year-old information. And we've learned so much about how the body works. So one of the reasons is people just aren't up to date. Reason number 2 is they only use one marker to determine thyroid wellness. They'll use TSH, which is a brain hormone. This signals your thyroid to make more hormones. And that, if you understand thyroid metabolism, there are so many other things involved and factors involved in good thyroid health. They just don't look at those. And part number 2 is they don't run complete tests. They don't look at the full picture. In my office, a thyroid panel is 10 tests, on top of which I'm doing blood sugar, I'm doing chemistry, I'm doing lipid panels, I'm doing inflammatory markers, I'm doing CBCs, I'm doing lots of different markers to look at the overall health of the person so we know who we're working with, because so many factors can affect how the thyroid works. And then 2, you're being compared to lab ranges. And what that means is, you know, what lab companies do is they collect all the data they get every year, and they find the average high and they find the average low, and that's how they determine their ranges. But the challenge is, who they're commonly seeing is the sick people. So what we've seen over years, those ranges gotten bigger and bigger and bigger. So what used to be abnormal is now borderline or something that they watch. And that doesn't catch all of it. I use much tighter values when I look at lab work to determine comparing where somebody should be in ideal health. Because there's a difference between ideal health and being, clinically sick. And in that space is an area we can do a lot to help a person. So that's some of the big reasons where it's got the 4 big reasons where I see people are on this endocrinologist merry-go-round. I hope this video is of value to you. If you like it, give it a thumbs up. If you know of somebody who could benefit from what we do here in our office, feel free to share it with them. And thank you so much for watching. Have a great day.